now is Doctor of Podiatric Medicine, Dr. Sheldon Nadal. Welcome, Sheldon.
Thank you very much.
Now, Sheldon, I want to really get into this about feet issues, okay?
Good.
I'm all about learning how to better help my feet because, as I just mentioned to you, I am a dancer. We spend a lot of time in our bare feet, and I feel like I have summer sandal feet.
Well, a lot of women are self-conscious about their feet, and a lot of women come to my office because they don't like something about their feet. They don't like the way they look.
Yeah. And I was saying that you can go and you get pedicures and things, but it's a health risk nowadays.
Well, you don't know where those instruments have been, and you don't know how they're sterilizing their instruments, so you have to be careful.
And you had a great suggestion. Sheldon said that I should bring my own instruments.
That's right, and that way you know they've only touched your feet.
I think it's great advice.
Sure.
I'm going to do it. Definitely going to do it. But what are, some sort of main foot concerns that people have?
Well, people come in because either they have foot pain or they have deformed looking feet and they're not happy about the way they look.
Okay.
Common problems include bunions, which are enlargements at the big toe joints, hammer toes, which are crooked toes.
Oh, this is a bunion here, right?
That is that is a bunion. The large enlargement at the big toe joint, that is a bunion.
Oh.
People do not like the way they look for some reason.
Yeah.
And they're hard to fit into shoes.
Yeah.
And they become painful.
They do.
There's also hammered toes, contracted toes that are crooked and rub in shoes.
Okay.
And when you get into your closed shoes, they start to get irritated.
Is that a hammer toe?
That is a hammer toe with a bunion deformity. So the bunion has pushed over, the big toe is pushed over, the toe is sticking up, and it's overriding the big toe.
Yeah.
And it's rubbing in the shoe.
I can't even imagine trying to fit that into a shoe.
It's not easy.
Yeah.
And other common problems include heel pain.
Okay.
Which is a very common problem, and it can be due to something called plantar fasciitis, which is an inflammation of a tendon on the bottom of the heel. And that can be treated with medication, and it can be treated with sound wave treatments and orthotics, insoles in the shoes.
Okay.
Other problems include skin problems and toenail problems, Alana.
All right.
We keep our feet in dark, sweaty boxes called shoes, and and the constant dampness is not necessarily good for your feet.
Well, I was going to say that now that it is, not summer anymore, it's winter, we're covering up our feet way more. So those sweaty boxes, it's a bigger deal now because it's going to be a reality for a long, Toronto winter.
That's right. Toronto winters are not conducive to walking barefoot or walking in sandals outside.
No. So nothing's breathing.
That's
true. You got
true.
Extra socks on, you got your nylons on. Sometimes you get water in there, and then, you're out there with moisture in your shoes.
That's right, Alana. So we recommend that you change your shoes every day. Don't wear the same shoes 2 days in a row. Give them a chance to dry out.
Oh, okay.
Make sure you wear something in your shoes that will absorb sweat, socks, in other words.
Okay.
And if you have any problems, you should see your podiatrist because things can happen such as you can get athlete's foot, which is a skin problem which is due to a fungus that infects the skin. And if it's left untreated, it can also lead to fungus in the toenails, which is harder to treat.
Ugh.
And they don't look so nice.
Yeah, I like foot fungus. Gross.
The skin can be treated with cream, but once it gets into the toenails, it's harder to treat.
Okay.
People can use topical medicine on their toenails, but it's not very effective.
Oh, is that fungus in the toenails?
The one on the left shows a whitish discoloration, which is due to a fungus, and then the toenail on the right has been treated with the YAG laser. I can't read how long it's been. It's been 3 or 4 or 5 months. I can't read it, but
8 months. I think.
8 months. Okay. So the person had toenail fungus on the left, and it was treated with the laser. And in 8 months later, it's an awfully lot better looking toenail.
Now, what is this laser treatment?
Okay, in the past, your choices for treating fungal toenails included topical medication, which is safe but not very effective.
Okay.
You could also take pills. The pills are more effective, but you have to take them for 3 months, and they have side effects. They can affect your liver.
Wow, okay.
But now we have a laser which preliminary studies indicate that it will give you similar results to the pills, but without the side effects.
Okay, and you are actually one of the first clinics to offer this in Canada, correct?
Well, I've got a YAG laser, a 1320 nanometer YAG laser, which is an infrared laser, and it was the first one delivered in Canada, and I've been treating toenail fungus since the end of August.
Okay.
It's very exciting because we're finding, studies are showing that approximately 75% of people with mild to moderate toenail fungus can expect a significant improvement with as few as 2 treatments with the laser.
Really? 2 treatments?
Yes.
And going from 3 months of having to take pills that might damage your liver?
I personally would not want to take the pills.
No. So the laser really is the way to go?
I think as of now, it's the best treatment that I know of.
Okay, wow. Well, that's breaking news. That's exciting.
It's exciting. Fungus in toenails is a very common problem.
Yeah.
Especially as we get older, more and more people get it, and they don't know how to treat it.
Now, what are some ways, like, I'm not even sure I would recognize that I would start to get a fungus. Like, how do you know if you're getting foot fungus?
Well, it starts out with a discoloration. It might be yellow, it might be whitish like that picture we saw, and it slowly progresses. It starts in a small part of the nail, and it slowly spreads to the whole nail.
Okay.
The nail can get thicker.
Oh, there's a little more of it, yeah.
There's another one. This is on the left. You can see the yellow discoloration in the middle of the nail, and on the one on the right has been treated.
I think 3 months of treatment there, yeah.
So you can see the yellow is moving toward the end of the toe.
Yeah.
The new nail is the nail on the bottom, and you can see it's clearer and it's pink and it's healthy.
Yeah, it's growing back way healthier.
And it doesn't happen instantaneously. Toenails grow very slowly. Mm-hmm. It can take up to 9 months to a year to totally turn over the old toenail.
Okay, yeah, of course, like the growth span.
It slowly grows, and as it grows out, you trim the dead or the discolored nail, and you end up with more and more healthy nail.
Wow, okay. Well, thank you. This is, I feel very enlightened about any foot problems I might have. I'm glad you came in today, Dr. Sheldon.
Thanks for having me.
For more information, you can go to www.footcare.net, and here is some more information on common foot problems.